Morning. This webinar is entitled Top Tips to Engage Your Stakeholders in the Delivery of 7-Day Services. This is a webinar that's been hosted by the Sustainable Improvement Team on behalf of NHS England and the National 7-Day Services team. This is a re-recording of a webinar that was held in March 2017. I'd like to introduce to you Jules Cowles, who is a consultant working in the University Hospital Southampton NHS Foundation Trust. Over to you, Jules.
Thank you very much. And thank you for giving me the opportunity to share our 5-year journey with a wider audience. Could I have the next slide, please? When I took on the job as the lead consultant for out-of-hours care in 2012, our organizational culture was very different from what it is now in 2017, and the best summary of this I could find is the cartoon you will see on the slide. In that, our senior decision makers and leadership teams were really working Monday to Friday, and the focus on running our services was also focused on the core office hours. Could I have the next slide, please? Since that time, we have changed our services beyond recognition, and I'd like to use this opportunity to share with you the approach we've taken and the practical steps that we have taken to realize our vision. So 5 years ago, we undertook some work to find out what our direction of travel would be as an organization, and we did quite a few stakeholder events throughout the organization, from the executive team to the healthcare support workers delivering care on the wards, to find out where everybody's perception was, where the gaps were, and what we needed to do in order to improve our services around the clock. That put us in a very good position to work with the national team when the 7-Day Services agenda really began to take prominence with the Department of Health and NHS England. Throughout this time, locally, we've had 2 chief executives who've been extremely supportive of our approach, and that has also led to a lead clinician being appointed into the role of out-of-hours and 7-day services consultant, alongside significant investment into clinical posts, mainly nurses and pharmacists and radiology consultants. Since that time, we continue to undertake regular gap analyses of our out-of-hours and 7-day services, and we feel that those two are closely interlinked, and I will expand on that a little bit further later in the talk. Our culture now is very much changed, and providing emergency care to the same model 7 days a week is becoming what we do around here. But like all organizations in a fast-paced changing environment, we're not perfect and we have much left to do. Next slide, please. So this is an overview of our 5-year plan. Our initial plan was to transform our hospital at night, and that involved standardization of processes across the trust whilst maintaining the identity and feel of each individual department. That put us in a really good position to become an early implementer site for 7-day services in April 2016, and on that journey we've received support from NHS England, Sustained Improvement Team, and from NHS Improvement, and that has been very helpful to us to have that external involvement also reflecting back to us the learning we needed to be on as an organization. We're now able to take this further for our organization, University Hospital Southampton, our clinical commissioning groups, and within our other regional networks. The latest addition to our regional work has been a regional 7-day services forum, where larger and smaller hospitals are working together in order to work out a strategic plan for the South region. Next slide, please. So the steps we've undertaken to transform our hospital had several aspects. First of all, we ensured there was senior leadership in all our departments, overseen and coordinated by a small group consisting of the Director of Nursing, the Medical Director, the Director of Transformation, and the lead consultant. Secondly, we have had open conversations with all our specialty lead consultants and matrons about the need of providing generic medical, surgical, orthopedic and pediatric cover out of hours versus specialist work during core hours. This has allowed us to pool resources considerably and work together and gain better understanding as a multi-professional team. The key for success was shift harmonization between different healthcare professionals so that nurses, doctors, pharmacists and physiotherapists can hand over at the same time and are part of one team. We've taken very much a human factors and healthcare approach to handover in that it is a checklist and process-driven event that is scheduled separately in everybody's rota as handover twice a day for half an hour, and has become very much an event that everybody turns up to on time and has a discipline to discuss large number of patients in a structured format. We are providing real-time education out of hours for the multi-professional team. It's only half an hour once a week, but it makes a big difference to how we all work together. And the topics covered there are specifically chosen to be relevant to all those attending. We've done some significant pieces of work together with NHS England on patient feedback and how their perception on overnight and 7-day care is. And we have introduced a new sleep and rest policy that gives helpful tips for staff and patients on how to create restful nights. Next slide, please. As an early implementer site, we had a lot of ground to cover in a short period of time to achieve our key clinical standards for 7-day services, and the foundations for that were laid by the out-of-hours work at our hospital. The awareness of providing equitable care throughout the week was raised through our out-of-hours project, and the culture change had already started. And I strongly believe that without that background work, we would not have been able to succeed. We have a staff and patient communication strategy that essentially repeats and updates the same information once every 3 months, so we keep this at the top of our trust agenda. In addition, it allowed us to identify our gaps in a different way, and in order to meet the standards required, we've introduced new job roles into our team. Doctors, administrators, medical assistants who now work as ward round coordinators, and acute care fellows who are senior registrars doing PhDs who contribute to our out-of-hours rota. We've put together formal educational packages for our multi-professional team, including our consultants, and because we had already harmonized our shifts, we were able to accelerate our 7-day service provision much faster than had we started from the beginning. Next slide, please. So our motto for 7-day services and out-of-hours care is always open, always ready, which has now become a trust-wide ambition. Our 7-day services plan is embedded in our regional sustainable transformation plan and our system resilience group, and this is again updated roughly every 6 months. And we continue to conduct regular gap analysis by meeting with each care group and specialty to discuss their workforce considerations, their budget setting requirements to achieve 7-day services, and we feed back their real data from the last 3 months to them, comparing their non-elective weekday versus weekend activities, so they can see themselves that the changes they've made are beginning to show in patient flow. We are also strengthening our links with the community, and those include our integrated COPD team, our neurology specialist nurses, and our older people's practitioners. And we are planning to expand this further. Our current priorities are to create a true 7-day service for pharmacy. We've already moved our pharmacy service to our dispensary being open 7 days a week from 9 to 5, and during the weekdays it is now open until 7 p.m. We have already created 13 more pharmacy posts to provide Sunday and Saturday daytime cover on all the wards, but we are still not quite there where we are during the week, and further work is currently carried out to achieve that. Our therapy services have done an interesting thing in that they have taken their existing workforce and they're beginning to stretch a 5-day workforce over 7 days. This leaves some gaps for all 7 days, and again, this is our current area of work. We are realizing more and more that employing clinicians is helpful, but that without the administrative clerical support in our clinical areas, those highly skilled and highly paid clinicians are doing tasks that could be carried out by other staff members. So we are bringing back weekend and late evening ward clerks in our high turnover areas. An ongoing concern remains our mental health provision in the emergency department, where we have a 5-day service and a very different service out of hours. This is something that's being addressed regionally, and we foresee a solution to this over the coming year. Our early pregnancy unit, at the beginning of 2016, when we started the project, was operating Monday to Friday, 9 to 5, and within a year they have moved to a 7-day service following the first survey cycle, when they realized that they were very much out of sync with the rest of the organization, and they've done an enormous amount of work with their midwives, registrars and consultants to get this to a 7-day unit. Next slide, please. Our current challenges are consistency of delivering clinical services 7 days a week in all departments, because we want to get to a point where staff working here and patients being admitted as emergencies really can't experience a different pathway, whether they're admitted on a Tuesday afternoon or at 2 a.m. on a Saturday. And although this is improving constantly, our current areas of challenge are weekend ultrasound services, which I understand is a national concern, and weekend therapy services. Weekend community services are working more closely with us now than they did a year ago, but we have some way to go. And the issue that we are grappling with are the boundaries between urgent and emergency care, and how best to engage with primary care and community services. And this work we are now taking to our regional working groups, and we anticipate that we will make some progress over the next calendar year. Next slide, please. So as part of our work, we looked at the weekend effect that was much publicized early in 2016. We wanted to know, looking at using the same methodology that was used in the well-published literature, whether having strong out-of-hours team and a strong 7-day services approach reduced our weekend effect. And as you can see, using the same time periods that were used in the published literature, we have come down considerably in our weekend risk by having a consistent approach throughout the organization. Next slide, please. When looking at what the significant changes were to conduct our work, we looked at weighted activity units, WAUs, in order to understand how we have delivered this service. And what is very interesting, that our hospital is in the green so doing very well in all areas other than medical staff per weighted activity unit. And despite being more consultant heavy and therefore having a higher medical bill than other trusts, this has allowed us to push a lot of other activity into the green area. And whilst I'm not sure that we can link them directly causally, we think that we have excelled in the areas we have excelled in because we've been able to provide senior clinical leadership. So that's really just there as food for thought. Next slide, please. And this is the same information again, just the figures more clearly illustrated as the chart's a little bit busy. So next slide, please. We felt that all this work was good, but we hadn't really engaged with our stakeholders since we had really driven the 7-day services agenda forward. And together with NHS England, we conducted a structured survey with the groups illustrated on this slide, and in the following slides I'd like to discuss the results. So I've provided a lot of detail in case anyone listening to this presentation would like to use the same exercise, which we found very useful. However, I'm not going to go this point by point. All I'd like to summarize is saying that I was a little bit concerned before the survey that staff would engage with the process and that they didn't feel that it was yet another survey, yet another questionnaire. And even though I didn't ask the questions myself, the feedback I got from the team who carried out the survey was overall, everybody was very keen to share their ideas and to talk, and were largely bought into the concept of providing the same service 7 days a week for emergency care. Next slide, please. Again, these are verbatim comments from the survey, and I think they're very interesting in that the staff who work here, and I'm sure also at other organizations, really see the need to deliver services 7 days a week. And if I just pick up the second point on this slide, 7 days is not difficult to sell in hospital. Staff think and know it's about improving safety of patients. It's not about out of hours working, it's about doing too much generalist stuff for the trusts. That's the main needs. So we end up doing less and specialized work we were employed for and we are most passionate about. And I think this is the balance that we still need to address. That tension between, we all know it needs to be done, but how do we do it, and how do we square the circle between specialist and generalist work? Next slide, please. As with any good survey, staff made suggestions for improvement, and I'm pleased to say that a lot of those we have been able to address, and that this survey was a very powerful tool in doing so, and a confirmation that our time and energy was spent in the right place. Next slide, please. I've mentioned this on quite a few slides that I've talked through, that partnership working has to be the next step in making this program sustainable and to deliver further improvements. And again, this came out really strongly in the survey, which gives me great hope that we're going to achieve this partnership working. Next slide, please. So our patients, as always, have a lot of good things to say, as are summarized in this slide, and quite a few critical comments, as are summarized in the next slide. Again, if you'd like to move on to the next slide, that would be lovely. Again, it's easy to focus on the bad and ignore the good. I'm pleased to say there were far more positive comments, but it's obviously the more negative comments that we can learn from most, and that have led to some of the improvements we've made since, such as the sleep and rest policy. Interestingly, the Trust has also changed caterers. We are looking at a public-facing website to describe 7-day services. In the emergency department, we have had a lot less queuing. We've provided chairs. We've turned quite a few systems around internally. So overall, without focusing on the negative, this has been an extremely good tool facilitating further changes and improvements. Next slide, please. And again, this is just a summary of the survey, and really just to say the rating of our departments was really unchanged from weekday to weekend, and the few points that we lost over the weekend were largely related to community services, so people having to wait for some things that weren't available in the community rather than what we provide in hospital. Next slide, please. So we are learning from each other. We've had a couple of very helpful meetings with our other early implementer sites, especially in the areas where we have most work to do, such as therapy and pharmacy services. We are collaborating regionally and increasingly with our community. So we have started specific work streams on 7-day community discharge planning, on patient pathways within the commercial healthcare sector, but also within our other local healthcare partners. We are working increasingly closely with primary care so that we get signposting for urgent care done much sooner without patients coming to hospital. And as mentioned earlier, we're doing some intense work to provide resilient 7-day mental health services. Next slide, please. So that brings me to the end of this really very brief overview. Should you require further information, our contact details are on the slide, and I'd like to thank the NHS England South team again for their opportunity to share this with you and for their ongoing support. Thank you very much.
Thank you, Jules. That's been a really, really helpful summary of all the enormous amount of work that you've been doing at Southampton. Just one question, I think. If you were going to give that one key message to other organisations who are struggling with some of those engagement messages, what would your core message be for people to try and get out about 7-day services working in trust?
What does good look like for your patients? Because that would be the key question to answer.
And it's interesting, isn't it? I appreciate you haven't had time to talk about it in this set of slides, but the work that you've been doing with some of your senior clinicians around that level of engagement. Is there anything else that you wanted to add about that?
So, interestingly, even though everybody pays lip service to, we must provide the same care 7 days a week. I mean, you would not meet anyone who works in healthcare or a member of the general public who would not understand that concept. Translating this into a day-to-day reality is quite different. So it's been quite important having consistency of approach, and I think, again, this will vary from organization to organization, but giving out the same message again and again to each department, professional group, senior leader that you work with. What does good look like in your department, and are you already providing this 7 days a week? And if you go to some departments, for example, the intensive care unit, the answer might be yes. If you go to other departments, for example, audiology, you might find that it's not actually requiring a 7-day services approach. So finding the right balance for each department and then getting senior leaders to buy into whatever changes need to be made to achieve that, I would say is a key step.
Thank you, Jules. I think that's a really important message, isn't it, for everybody? And certainly working with senior clinicians across 7 days, that really seems to be one of the big take-home messages. It's about, as you said, engaging the right people and giving people the information so that they can understand their own services better.
Yeah.
And as you say, applying them appropriately seems to be part of that message. So thank you so much, Jules, for providing that presentation for us as part of the series of national webinars. This will be publicised and available on a number of websites. So we'll be providing that link to all of our stakeholders. And again, people can see your contact details on the previous slide. And if there's anything else that we can do in terms of support across 7-day services, our contact email is there, england.si 7-day services support@nhs.net. Thank you very much, Jules, and we thank you to everybody who listens in. Thank you, Jules.
Thank you.